Good morning, everyone. Thanks for joining us today. This is Erin. Katy and I are going to share the training, and we work out of the Pennsylvania Health Law Project Pittsburgh office. Katy is a supervising attorney, and I'm a paralegal. So we have a lot of information to share with you today, and this topic, we geared this training towards people that are either new to this work or maybe who work with older adults but don't necessarily deal with healthcare issues on a daily basis, to try to give an overview of various issues or programs that can help them. But we know that this is a mixed audience. So for some of you, this might be a review of information, and for other folks, you might be learning about things for the first time. We hope that everybody finds something useful, and we think that this information is important to your work, but can also be important for your personal lives as you might try to help families and friends navigate these different systems. So please chat in questions. We're going to do our best to address questions as we go through this training today. And in case people aren't familiar with the Pennsylvania Health Law Project, we're a specialty program that's part of the Pennsylvania Legal Aid Network. Our focus is really narrow, and we spend most of our time helping people get and keep coverage through Medicaid. So that's one way we differ from other regional programs, but the other way we differ is that we don't necessarily have income limits that apply when we can help people. So we're able to help folks that maybe are over the income limits to qualify for services through your programs. And then we are available to provide technical assistance. You know, Katy and I are always happy to answer questions about the content that we're discussing today, or feel free to reach out to the Health Law Project if you have a case that you're seeking advice on. We're happy to talk through cases with you and provide technical assistance. So today we're going to cover health insurance. We're going to kind of review Medicare and Medicaid Basics. Then we're going to talk about long-term care, and then we're going to talk about prescription drug programs. So to start with the Medicare program, this is the federal health insurance program that's primarily for older adults. It's administered by the Centers for Medicare and Medicaid Services, a federal agency. They kind of oversee the Medicare system, but the Social Security Administration is involved, and they handle enrollment into the program. So in terms of who gets Medicare, again, most people on Medicare are older adults who are age 65 and older. But sometimes younger people can get Medicare too if they've been getting Social Security disability cash benefits for 2 years. The exception to the 2-year waiting period is people that have Lou Gehrig's disease or ALS. Folks with that condition get Medicare as soon as their cash benefits from SSDI start. And then people of any age who have end-stage renal disease and who are getting dialysis or who have had a kidney transplant are also eligible for Medicare when they had that condition. So enrollment into Medicare is generally automatic for people, but you have to be kind of known to the Social Security system and receiving benefits for the Medicare enrollment to be automatic. So now people are waiting longer to take Social Security, so people may not be collecting Social Security retirement benefits at 65. They may be waiting till 66, and in the future maybe 67. So if somebody isn't getting Social Security benefits when they turn 65, they're going to need to take some action to flag themselves to the system and take action to enroll in Medicare, or they want to be talking to people that are knowledgeable about the enrollment rules that we're going to kind of touch on in a little bit to make an informed decision about whether they can delay enrolling in Medicare without any negative consequences down the road. And then people with end-stage renal disease usually have to enroll because they're not necessarily getting Social Security benefits. And dialysis social workers and transplant social workers can help them get enrolled in the Medicare program. There are 4 main parts to Medicare. There's Part A, that's sometimes also referred to as hospital insurance. And this typically covers care that people get in a facility, inpatient care. So it covers hospital care, it covers some short-term care in a skilled nursing facility or rehab. It covers home health care that people need when they leave a facility. There's some visiting home health services available to people. And then it covers hospice benefits that people get at the end of their life whether they're getting this care at home or if they're getting care in a hospice facility. And then Medicare Part B is the part of Medicare that covers most of the services that we all get on a regular basis. This is sometimes called medical insurance, and it covers outpatient care. So doctor's visits, lab work, diagnostic tests, if people need mental health care. Those are the sorts of things that the Part B part of Medicare covers. Then Part C isn't really a benefit, it's more of a way that people can get their Medicare coverage. So Part C refers to managed care. The formal name for that program is called Medicare Advantage. And Medicare Advantage plans have to cover the same services that are covered under Part A and B, but they can also cover extra services that Medicare A and B don't cover. So some examples of this are vision benefits, eyeglass, eye exam coverage, dental coverage. The original Medicare program doesn't cover vision and dental, but Medicare Advantage plans can. Some of them are starting to offer home delivered meals, maybe for 2 weeks after somebody's in the hospital. They might offer a gym membership. So there's a lot going on with extra benefits in Medicare Advantage, especially in those last couple years. But it's a managed care system, so people have to follow their plan's rules to get care covered. They have to stay in networks usually. They might have to get referrals from their primary care doctor to see specialists. Their doctors typically have to get prior authorization for certain things to be covered. So there can be some challenges navigating getting care under this system because of some hoops that people have to jump through. And then Part D is the prescription part of Medicare. This started back in 2006. People get their Part D coverage through either a standalone prescription drug plan or through a Medicare Advantage plan with their health benefits. Every plan has its own list of covered drugs, and there are certain rules that apply. The plan decides whether somebody needs authorization for a med to be covered, or if they have to try other medications before a certain medication can be covered. So that's the Part D prescription drug benefit. So that's just kind of a general overview about the different parts of Medicare and what's covered under the various different parts. And a lot of people think, I just need to make it to 65 and then I can get Medicare. And Medicare provides good, broad coverage, but it can be costly, especially for our clients with limited income and resources, or even if you have moderate income, but you get a lot of health care, it can end up being pretty costly coverage or costly to get the healthcare services that you need. So this slide includes information about the current cost for the Medicare program. Just to highlight some information, most people don't pay for Part A coverage. They've paid in through their taxes, through their work taxes, or through their spouse's work. So for most people, there isn't a charge for Medicare Part A. But for other people, maybe who didn't work in the US, maybe immigrants that came to the country, some people have to pay for Part A coverage, and it can be expensive, up to about $450 a month for coverage. And then there's deductibles and copays that apply. For Part B, the premium is $144.60 a month. People with limited income and resources may be able to have Medicaid cover that cost, as Katie's going to talk about. And then people that have higher incomes have to pay a higher premium for Part B. But everybody has to pay a premium for Part B. And then essentially you're paying for the first $200 of the care you get under Part B. And then after you meet that deductible, Medicare covers 80%. And the individual pays 20%. And then the cost for Part C and D differ depending on what plan people join. It's the plan that sets the premium and the copays and deductibles. But one important thing to note for Part C, Medicare Advantage coverage, is that for people in a Medicare Advantage plan, they still have to pay the Part B premium that everybody on Medicare has to pay, and then they'll have to pay their Medicare Advantage plan premium on top of that. People need both A and B coverage to be able to join a Medicare Advantage plan, and they still have to pay that Part B premium, which some people, have trouble understanding. Enrollment rules for Medicare are very strict and they're very nuanced. So Medicare limits when people can join Medicare or when they can make changes to their Medicare coverage. And the rules for enrolling into Medicare Part A and B are different from the rules for enrolling into Part C and D. So right now, starting next week, we're entering into what's called the annual open enrollment period, where people on Medicare are very popular. They're getting a lot of mailing, there's advertisements on TV from various health plans, there's ads on buses and at bus stops and billboards that you all might see. So starting next week, everybody on Medicare can change their health or drug plan. This is the one time of year where people can make changes for new coverage to start January 1st. And everybody on Medicare really should be reviewing their coverage to see if that plan is still the best plan for them, whether it's health and drugs or just prescription coverage, and making changes during this period if they want to pick a different plan for next year. And if people don't enroll, especially into Medicare Part B as in boy, when they're first eligible, they may have to wait to get coverage and late enrollment penalties can apply. And again, these rules are complicated. We really encourage people to talk to the Apprise program or a trusted broker or somebody at Social Security to get information about their situation to know whether they need to take Medicare at 65 or whether they can delay that without, again, having any negative consequences. Because for people over 65, if they don't take Part B right away, they will have a late enrollment penalty, or they could have a late enrollment penalty that they have to pay for the rest of the time that they're covered by the Medicare program. And we certainly hear from people who did reach out to Social Security or did talk to people and didn't get accurate information about their situation. Or we talk to people who, at 65, they were healthy and they weren't needing health care, and so they didn't want to spend the money to pay for Medicare coverage. And then a couple years goes by and their situation changes and they find themselves not able to get into Medicare when they need the coverage, and they're paying more for that Medicare coverage. And again, that lasts for the rest of their life after age 65. So we gave some enrollment resources, and we can certainly address specific questions or talk to people after the webinar about these things, but just know that there are rules and they are complicated and nuanced. So essentially people on Medicare can choose to get their coverage through the original Medicare program or traditional Medicare. This is where they would use the red, white, and blue card. Typically when people choose original Medicare, because of the costs, the deductibles and co-insurance, they need other coverage. So for a lot of our clients, they're covered by Medicaid, and that serves as the secondary coverage to cover the Medicare cost sharing. But Medigaps are another option for people maybe that don't qualify for Medicaid coverage. And then people will need a separate prescription drug plan when they choose to get their coverage through the original Medicare system. And then the other option is getting coverage through a Medicare Advantage plan. And again, there's plans that just cover health benefits, and there's plans that cover both health and prescription coverage. So there's a lot of plans available. I think there's 20 to 60 Medicare Advantage plans available to people depending on the county where they live. It varies county by county. And just some examples of Medicare Advantage plans around the state: Geisinger Gold, Security Blue, UPMC for Life, Aetna. But again, there's certainly many more plans. And if people choose that option, again, they have to follow rules. There's some hoops to jump through. But those are generally the two choices of coverage for people on Medicare. And then the last thing I wanted to mention about Medicare is just to give some highlights about Medigaps. These are supplemental policies. They're sold by private companies, and they're intended to fill in the gaps of Medicare. They cover deductibles and co-pays, but they work as secondary coverage to Medicare. They don't cover any extra benefits the way that the Medicare Advantage plans can and often do. So again, the best time to join a Medigap is when people first become eligible for Medicare, because otherwise if they wait, they may not be able to get coverage. Plans can deny them after a certain period of time, and people may have to pay more based on their health conditions. So the Medigaps are all standardized. So if a Medigap Plan A, regardless of what insurance company provides that coverage, Plan A covers the same thing. It's just the costs vary depending on what insurance company and which of the Medigap plans you join. So, and there's a link to a resource if people want to find more information about Medigaps. But that is a very quick overview of the Medicare program. I'm going to turn it over to Katy for some Medicaid basics, and then we can address maybe some questions that come in before we move into the second half, if that works. So I'm going to stop sharing, Katy, and have you start to share your screen.
Thank you, Erin. All right. So I am going to talk a little bit about Medicaid basics, as Erin said. So Erin talked about Medicare, and Medicaid is the other big public health insurance program that provides health coverage to many older adults. In Pennsylvania, we call Medicaid medical assistance, but I think, you know, during this presentation, you'll probably hear Erin and I both talk about it as Medicaid. So it is a federal health program, but it's run by the State Department of Human Services. In order to qualify, you must have limited income and fit into certain coverage groups, which we'll talk about a little more. For some people, Medicaid is their only coverage, or it can be secondary coverage for people who also have Medicare or other private health insurance. And Medicaid is always going to be the payer of last resort. So if someone has other coverage, Medicaid is always going to be their secondary coverage. And folks who are covered by both Medicare and Medicaid, which is a significant portion of the folks that we talk to, are referred to as dual eligibles. So just some preliminary basics. In order to qualify for Medicaid, you must be a US citizen or meet the required immigration status. And that immigration status piece is fairly complicated. And I know Maripat Pileggi from CLS did a whole session on immigrant access to public benefits earlier in the plan conference. So I'd recommend looking into that training if you want to dig into these sort of standards that immigrants have to meet to get Medicaid coverage. You have to be a resident of Pennsylvania, but that's a very low standard. Basically, you have to be here in Pennsylvania and have an intent to stay. And then you have to fit into one of the covered groups or categories that we'll talk about and meet the income and resource limits for that category. So as I mentioned, there are lots of ways that people can qualify for Medicaid. For older adults, the ways that they can qualify become more limited once they become Medicare eligible. But we have here a list of the categories, which are most of the ways you'll see older adults qualifying for Medicaid. In addition to the slides we included in our materials in the Sketch app, the 2020 income and resource limits for the various Medicaid categories, along with a few other health programs. So we'd certainly refer you to that. And that's a publication that we update every year once the new income limits and resource limits come out through the category for the categories. So you see that people on SSI automatically get Medicaid coverage. Healthy Horizons is the category for folks who have either very low income or disabilities. Medicaid expansion is available up until people become Medicare eligible, up until age 65. And then medical assistance for workers with disabilities is another common category that we refer people to for people that's available up until age 65. For people with chronic health conditions, I think the name sometimes puts someone off. You don't have to be on disability to qualify for this category of Medicaid, but if you have a chronic health condition, you're doing some work, and you need ongoing care, it can be a good option. And then Erin's going to talk about the long-term care Medicaid categories, about the waiver programs in nursing home Medicaid. There is also Medicaid available for folks who need breast or cervical cancer treatment if they have no other health insurance, and there are no income limits for that category. So there are a couple of categories that help people with Medicare costs only. So some folks, when they get on Medicare, they don't qualify for full Medicaid benefits, but they may qualify for one of these categories that primarily provide help with the Part B premium. The lowest income folks, people who fall into this qualified Medicare beneficiary category, who are below 100% of the federal poverty level, get that help with the Part B premium and also with their Medicare cost sharing. So these three programs listed here are called the Medicare Savings Programs. All right, so, and of course, with Medicaid, it can't be simple. So each of these categories that I have listed here have different income limits. There may be different rules for how income is counted and whose income is counted in the household. Most categories have resource limits, but not all resources count. So this can be fairly complicated. So feel free, if you're working with somebody who wants to kind of go through and see, do I qualify for Medicaid? I'm having trouble affording my Medicare costs. You know, feel free to refer them to the Health Law Project. We're always happy to talk that through with people. So the vast majority of people on Medicaid have no monthly premium. Unless you're in the MOD program that I mentioned, that's the only category of Medicaid that you have to pay a small premium for based on 5% of your countable income. So generally that's an affordable premium. But for the majority of people on Medicaid, they are not paying any premium. There are very small copays, $3.80 or less for Medicaid services. So if you have someone who's on Medicaid and they say they received a bill for more than that $3.80, it's worth looking into whether they're being improperly billed. There's billing protections on both the Medicaid and Medicare side, which could be its own separate training, but we do sometimes see people being improperly billed. Medicaid does offer a broad benefit package. It's good comprehensive coverage, but it's a complicated program, so it can sometimes be difficult to navigate getting or using coverage, especially if someone has multiple insurances. Medicaid does cover prescription drugs, but if someone is on Medicare and Medicaid stops covering prescription drugs, and the person gets their prescription drug coverage through Medicare Part D as in drug. People get their Medicaid in one of three delivery systems. So there are some people who just have the access card. Everyone on Medicaid gets the access card. And for some people, that is their coverage. They have fee-for-service Medicaid through their access card, which is a smaller and smaller group. We see folks who are in the autism or intellectual disability waivers there in the fee-for-service program. But the majority of people in Pennsylvania who have Medicaid now are in managed care. If someone is on Medicaid as their only insurance and it's not long-term care Medicaid, they're likely going to be in a Health Choices plan for their physical health coverage. And there's several plans available. They vary by region, but it includes plans like UPMC for You, Gateway, Aetna Better Health. If someone is a dual eligible, they have Medicare and Medicaid, or if they're receiving long-term care Medicaid for a nursing home, or if they're in the Community Health Choices Waiver Program, they're going to get their Medicaid physical health coverage through a Community Health Choices plan, like UPMC Community Health Choices or PA Health and Wellness. And this is where you'll see most seniors with Medicaid coverage. So people who fall into either Health Choices or Community Health Choices have a separate managed care plan for their behavioral health coverage, and that's determined by the county they live in. So it could be like Community Care, Behavioral Health, or Value, Magellan. So there's lots of ways to apply for Medicaid. People can apply by mail, online, or in person, although not currently since the county assistance offices are still closed to the public. You can apply at any time. There's no enrollment periods. People can apply anytime they want. If they've been denied in the past, that doesn't matter. They have a right to, file a new application and get a new determination. You do have to provide verification documents after applying, which sometimes slows down the process to verify your income and resources. But in general, the county assistance office is supposed to make a decision on an application within 30 to 45 days and provide a decision in writing with appeal rights if the application is denied. So just a few sort of Medicaid tips. In general, I think the Compass application that you can do online is often the easiest way to go. But for certain programs, if you're applying for MAUD or for the Medicare savings programs to help with the Part B premium, sometimes it's easier to just do the paper application. Especially for the Medicare savings program, the paper application is shorter for people who know they're just looking to apply for that program. For Medicaid programs, you do have to do an annual renewal to confirm you're still eligible. And if you don't complete the renewal, your benefits will end. People on MAUD have to renew every 6 months, but generally for everyone else, it's an annual renewal. And in between those annual renewals, people are required to report changes in their income, resources, household address, etc., generally by the 10th of the month following the month when the change happens. So if I got a new job this month in October, I would need to report that to the county assistant's office by November 10th. And making those reporting those changes is really important, because if you don't report, that can lead to an overpayment, or you move and don't report it, mail gets sent to the wrong address. I had a client a few months ago who didn't even realize he had Medicaid for 3 months because he had moved and not reported his change of address and thought his application was just never processed. So it is important to report those changes. We recommend reporting in writing and keeping proof of what you submitted and how and when you submitted the report of that change. Before terminating someone's Medicaid, the county assistant's office is supposed to review to see if the person qualifies for any other category of Medicaid. For example, when someone turns 65, they become Medicare eligible. Maybe they're no longer eligible for Medicaid expansion, but they should be reviewed to see if they might be eligible for help with the Medicare Part B premium, for example. Any termination notices should be in writing with appeal instructions. And if people appeal a termination notice within 15 days of the mailing date, they can keep their benefits in place while their appeal is pending. You can verify someone's Medicaid status by calling the Department of Human Services helpline or statewide customer service center number, and we have that information later in the materials. So this can be a particularly difficult transition for people becoming eligible for Medicare, and we get a lot of calls from people who are going through this transition and just kind of need help understanding their new coverage and how their insurance is going to work. If they're still eligible for Medicaid after they become Medicare eligible, their Medicaid coverage is going to change. Medicaid stops covering their prescriptions. They have to get their coverage through Medicare Part D. They likely have co-pays they never had before. So it's just sort of a challenging transition. I think, as Erin said, these are two really good coverage programs, but they're complicated. So with that,
Sorry,
Oh,
if
go
I
ahead,
could just
Kelly.
interrupt. This is Kelly, and I'm launching the first of the 2 CLE poll boxes. If you're an attorney requesting CLE credit for your participation today, please respond now. You'll have about 1.5 minutes to do so.
All right.
Thanks.
And I'm going to turn the screen sharing back over to Erin, but Kelly, do we have any questions in the meantime?
The only question was the question that Erin responded to. What is the name of the healthcare broker you recommend?
Okay, great.
And the response to that is in the chat.
Okay. All right, so now we're going to talk about long-term care. And again, like Katie said, probably all of these topics we're covering today could be their own training. So we know that this is kind of a quick review of information or a quick summary of these challenging programs. But again, hopefully you have resources and you can always reach out to us to ask questions if you have specific things that we don't address today. So moving on to the long-term care coverage. So Medicare covers short-term care in nursing homes or rehab facilities. It does not cover long-term care. So the most Medicare will pay up to 100 days if somebody needs skilled nursing care, but there's criteria that have to be met for Medicare to cover this level of care. Someone has to be admitted to a hospital for at least 3 days before they go to a nursing home to have Medicare cover that nursing home stay, and they need to meet the criteria for skilled care. So even though Medicare can come up to 100 days, cover up to 100 days of skilled care, often they're covering less than that. Maybe 20 days or 30 days or 50 days, but we rarely talk to people that get the full 100 days of coverage by Medicare for a variety of reasons. But 100 days, that's a little more than 3 months. So anybody that needs to be in a nursing home longer than 3.5 months, or if they don't maybe have the qualifying coverage through Medicare to have Medicare cover that stay, they are often turning towards Medicaid. And Medicaid is the really only payer of long-term care services, whether that long-term care is provided in a facility like a nursing home or in somebody's home through the home and community-based service programs available that we're going to talk about here in this section. So even if somebody is already on Medicaid and they need long-term care, they have to apply and get approved for Medicaid long-term care, even if they're already on Medicaid. And that's just because the rules to qualify for long-term care Medicaid differ from the other Medicaid categories that Katie just talked about. So again, if my dad's on Medicaid because he has limited income and resources, and then his health starts to decline and he needs some supports at home, he has to go through another application process to get the long-term care Medicaid. It's not enough that he just has the Medicaid available for health insurance. So there are some general basics that apply to any Medicaid long-term care coverage that we just wanted to quickly highlight. So one thing is that somebody has to be clinically and financially eligible. So we're going to talk a little bit more about this, but generally speaking, people have to be found to be what's called nursing facility clinically eligible, or NFCE. All of these programs have a number of acronyms. And then in addition to that, they have to meet income and resource requirements. There are special rules that apply to married couples who are seeking long-term care coverage through Medicaid. These are referred to as the spousal impoverishment rules. The PowerPoint does include a link to the long-term care handbook that details these rules. But generally speaking, if somebody's married, these rules govern how Medicaid is going to look at income and at resources when they're processing an application for long-term care Medicaid. The state recovery also applies to people if they get long-term care and they're 55 years old or older. And this estate recovery, I think there's a lot of misunderstanding about estate recovery. And we certainly talk to people that turn down waiver services because of estate recovery. And sometimes they think that, the state will immediately come and take the person's house or immediately put a lien on the house. And that's just simply not the case. So estate recovery means that if somebody gets long-term care and Medicaid pays for that, then after the person passes away, if they have an estate, then the Medicaid program may take action to recoup some of the cost of the care from that person's estate. Again, there are lots of nuances to this. And there's a good brochure that the Department of Human Services has on its website. And there's a link, if you click on this estate recovery in the PowerPoint, that'll take you to that brochure. But again, people do sometimes not accept Medicaid long-term care services because of the estate recovery rules. And then Medicaid long-term care also does a 5-year look back of resources. So generally, when someone's applying for regular Medicaid, Medicaid is looking at their situation at the time that they're applying. They're looking at what the income is and what the resources are. They don't look back for regular Medicaid. For long-term care Medicaid, they do look back because they're trying to make sure that people didn't give away money or try to hide money that they really should be using to pay for long-term care services in order to get Medicaid. And again, for any of you that that do some of this work, you know that this 5-year look back can be challenging. People have to get bank accounts for the last 5 years. They have to, maybe provide verification of where money went. If they sold a car, they have to provide information that they got fair market value, or if they sold a property, they need to verify that they received fair market value for that sale of the property. So this can pose some challenges to folks. And if Medicaid determines that somebody did transfer resources for less than fair market value, they'll calculate a penalty period. and somebody won't be eligible for Medicaid long-term care coverage until that penalty period expires. So to talk a little bit more about how Medicaid works for people who are getting nursing home care. And again, right now during the pandemic, people, you know, if you're not already in a nursing home, I think people would really struggle with the decision to go to a nursing home or send a loved one to a nursing home. But the reality is that some people, you know, that the nursing home is the only option for them to get the care that they need. So if somebody's in a nursing home, they generally help somebody apply for Medicaid, and somebody might need to seek Medicaid as soon as they go to a nursing home, or maybe they've been in a nursing home and they've used their resources to pay for that nursing home care, and now their resources are getting depleted. So for nursing home Medicaid, essentially there is no income limit. If somebody has higher income, then a lower resource limit will apply, but then the person will also just pay a higher cost of their care to the nursing home. So when Medicaid looks at eligibility for nursing home Medicaid, they're going to look at the income of the person that's needing the nursing home care. But some of the money that that person has might be able to be shifted to a spouse if they're married and the spouse is in the community and needs money from that nursing home resident to be able to pay bills to stay living in the community. So kind of, they look at the individual applicant's income, but some of that income may be able to be shifted to a community spouse if that applies to the person's situation. And then the resource limit that's used for the nursing home Medicaid depends on income. So if somebody has lower income, then a higher resource limit will apply. And the figures are on the slide here. And if somebody has higher income, then there's a lower resource threshold that applies to determining eligibility for nursing home Medicaid. And then if somebody's eligible, the county assistance office determines how much that individual has to pay towards the cost of the nursing home care. And again, they will factor in if people have to pay that Medicare Part B premium. They will allow people to keep their money to pay those medical bills that they have each month, or to pay the community spouse to be able to maintain living in the community for that spouse. But then otherwise, all the income aside from $45 gets paid to the nursing home. So people pay their cost of care as determined by the county assistance office, and then Medicaid may make an additional payment to the nursing home for the care that that person receives. So nursing home Medicaid is an entitlement, which means that if somebody's in a nursing home and meets these criteria, then Medicaid covers them. There's no limit on how many people can get Medicaid in a nursing home. Sorry. The other option for long-term care Medicaid is the home and community-based service waiver programs. So right now, the program that's available to older adults in Pennsylvania is the Community Health Choices Waiver. And this is an alternative to people to be able to stay living in their community at home, maybe with their family, as opposed to going to a nursing home to get the care. This used to be the aging waiver and then some other waivers for people that were under the age of 60, but all of those waivers got replaced, or most of those waivers got replaced by the Community Health Choices Waiver that's now statewide as of the beginning of this year. If somebody's eligible for the Community Health Choices Waiver, they get Medicaid coverage and waiver services. So waiver services are also sometimes called long-term services and supports, or LTSS. And then for some people, they're only eligible for Medicaid because they need waiver services and they qualify for a waiver. The income limit for the waiver is $2,349 a month. There are no deductions. So if somebody's income is just $1 or $2 over that limit, that can pose a real challenge to them. Only the applicant's income counts when determining eligibility for the waiver. So the person that needs the waiver services, that's whose income they're going to look at. And just to note, if you're working with somebody and they're otherwise eligible for a waiver program, but their income is too high over this limit, please contact us at the Health Law Project. There is a fairly new option to allow people who have income that's about $500 over this income limit to be able to spend down to the $2,349 level by establishing an income spend down trust. So please reach out to us and we can talk more about that. And then the resource limit is $8,000 for waivers. Now, waivers are not entitlement programs. So in Pennsylvania, there's a certain number of slots available to people that need home and community-based care through the Community Health Choices system. Luckily, we've not had an issue where people, older adults and younger people with disabilities who need care through this system aren't able to get it because there aren't slots available. That is a real problem for people with intellectual disabilities, where for a number of years, there's been thousands of people on a waiting list. So I'm just flagging this because in the future, depending on budget situations or whatnot, there could become a time where there are slots, limited slots available, and people who need the home and community-based care may not be able to get it. But right now, there's not a problem with people not having slots available to get into the Community Health Choices waiver. There's a number of steps involved in the application process to get the Community Health Choices waiver. Generally speaking, people should call the enrollment broker, the independent enrollment broker that is Maximus right now, to start the application. The enrollment broker will send a form to the person's doctor to fill out. They'll do a visit with somebody. Right now, these visits are being done over the phone to kind of gather information. Somebody will have to complete an application for Medicaid if they're not already receiving Medicaid benefits. Then the aging office does an assessment of somebody's functional abilities. And then after kind of those steps happen, the enrollment broker reviews that information and decides whether somebody meets the clinical criteria or not. And again, both the aging visit, I think, and the enrollment broker visit right now are being done over the phone as opposed to in person. So if somebody qualifies, or if somebody doesn't qualify, if they're considered nursing facility ineligible, then the enrollment broker or the Office of Long-Term Living will send a denial letter with appeal instructions. If somebody does qualify clinically, if they're found to be nursing facility clinically eligible, then the enrollment broker will send the application to the county assistance office for a review of financial eligibility. The county assistance office will let folks know if they need additional information. Then they'll make a determination. If somebody's denied, either because they don't meet the financial criteria or they failed to provide all the documentation needed, they should be sent a denial notice that can be appealed. And then if somebody's approved, then they'll be kind of immediately enrolled into a CHC plan that they picked as they were going through the application process with the enrollment broker. And then within 5 days of the Community Health Choices plan start date, they're supposed to be assessed to determine their needs and what services will be put in place to meet those needs. So this whole process takes about 90 days from start to finish, and people run into a bunch of problems at various points along the way. So we really encourage people to not wait until the last minute to apply for these services, because that can really kind of put people in a bind if they need services quickly. Right now, there really is not any process to expedite this application process and enrollment. The other thing to note is that there isn't any retroactive coverage of waiver services. So we've definitely talked to people who maybe have been paying out of pocket to keep their mom at home with the thinking that they could get reimbursed once the mom got approved for the waiver program. And again, that's not the case. The waiver program will only start to pay for services after someone's approved and after they have an assessment with a determination of what the needs are and an approved service plan. This slide just highlights the kind of services people can get to keep them at home. Things that aren't on this slide include home delivered meals or a personal emergency response button. You know, a lot of our clients get personal assistance services to have a caregiver there to help them with their activities of daily living, like bathing, dressing, toileting, etc. So again, we know that that was a quick overview. I'm going to talk about life real quickly, but I did want to put a plug for people that want to dive deeper into the eligibility for the waiver. I really encourage you to look. There was a training yesterday on October 6th about accessing Community Health Choices waivers. Look at that material, listen to that recording. They dive into a lot more details about the eligibility for the Community Health Choices waiver, both on the clinical side and the financial side. And then the last slide I'm going to cover today is just about the LIFE program. This it stands for Living Independence for the Elderly. There are programs available in most areas of the state. There are some central Pennsylvania counties that don't have a life program yet. But this is an option for people that are 55 and older that want to stay in the community. If there's a life program and the life program accepts them, then they can get services through the life program. This is different than community health choices. If somebody's in life, life essentially becomes their insurance and their provider. So people have to see doctors through the life program. They have to get all their services through the life program. And oftentimes they're going to an adult day center a couple times a week to get services, and they may or may not get services at home in addition to the care that they get at the center, assuming the center is open in the area where they are because of COVID. So this, it's a different model. It works well for some people, but other people don't want to give up their doctors, or they don't want to kind of go to the day center during the week to get services. They want to get services at home without having to go out. And so that's where they would pursue the community health choices waiver. And again, the life program is another option that's available to people. All right, so with that, I'm going to turn it back over to Katy.
All right. Oh dear, what happened here? Sorry about that. I thought I was in the right place. Okay, thanks, Erin. So we wanted to talk a little bit about programs that help with prescription drug costs for seniors. So the first program I want to talk about is the Extra Help program. This is also called the Low Income Subsidy Program, because why have just one name for a program? But this is a Medicare program connected to the Medicare Part D benefit, and it helps people who qualify with their prescription drug costs. Social Security administers this program, and there are 2 levels of extra help, but essentially this program helps people by lowering their Part D premiums, their annual deductibles, and copays. The other really great benefit of this program is that if someone didn't enroll in Medicare Part D timely, and as a result they have a late enrollment penalty, if they're eligible for extra help, the late enrollment penalty is eliminated, even if later down the road they are no longer eligible and lose extra help. So Erin talked about this a little bit, but even with Part D coverage, prescription drugs can be very costly for people on Medicare. They're going to be paying a monthly premium for their Part D plan, have an annual deductible and copays, and this can amount to thousands of dollars a year in out-of-pocket costs. And for people who are dual eligible for Medicare and Medicaid, remember that Part D is their drug coverage. And when someone becomes Medicare eligible, Medicaid stops covering their prescription drugs. So unfortunately, we know that many people still don't know about the Extra Help program or how to get this help. So it's always worth checking when talking with someone on Medicare about whether they're getting extra help, and if not, reviewing them for eligibility. Sometimes people applied at one point, they were over the income or resource limit, maybe their financial situation has changed, they've lost their spouse, or something has changed and they're now eligible and just don't realize it. So how to qualify for extra help? There are 2 ways to qualify. If someone is getting any Medicaid benefit, even if the only Medicaid benefit they get is help with their Medicare Part B premium, they automatically get full extra help and don't need to apply or meet the income and resource limits. So those people aside, everyone else who's not receiving any Medicaid benefit does need to apply and meet these income and resource limits. And just to note, these are the 2020 income and resource limits. We do put out an updated guide to this program every year around February when the new federal poverty level guidelines come out. So you can check our website if you need that in the spring. I will note the resource limits include a $1,500 per person funeral burial disregard, and this is given to people who indicate on the application that they plan to use some of their resources for funeral or burial costs. People automatically get that. So it's only if you say no to that question on the application that you don't get this disregard. And not all resources count, you know, the applicant's home, vehicles, burial plots, life insurance, none of that counts. So okay, I'm not sure what happened there. I would encourage them to apply. So this is the assistance here you get if you're on Extra Help. If you're on the Extra Help program, you can get 100% of the monthly premium paid for up to a certain amount. This year it's $35.63. It's going to go up a little bit in 2021. There are several zero premium prescription drug plans available each year that if you choose them, you don't have to pay a monthly premium if you're on Extra Help. And if you pick a Part D plan or a Medicare Advantage plan with Part D coverage and the premium is above the amount that the Extra Help program will subsidize, you do have to pay that additional amount above that $35.63. So for people with full Extra Help, you know, they're not paying any annual deductible. Their copays are pretty minimal. But you can see that even these minimal copays can be a shock for someone if they had Medicaid before, they have very low income, and maybe they didn't have to pay anything for prescriptions before. The numbers we have on here, it's $1.30 for generic prescriptions, $3.90 for brand name prescriptions. And that's true for each of the categories. People who are on the long-term care Medicaid programs like the waiver or nursing home don't pay any copays for their prescription drugs. So applying for Extra Help, it's generally best to do online. It's a simple application. You don't have to submit any verification with the application. Social Security will reach out if they need to verify something. Paper applications have to be originals that you pick up at the Social Security offices. And, you know, with the Social Security offices currently being closed, that's not an option. And I think the last time we checked a local Social Security office, the paper applications they had for Extra Help were out of date. So I really would encourage folks to apply online or refer them to the Apprise program that can help people apply for the Extra Help program. And Apprise is Pennsylvania's state health insurance program that provides free help and counseling to Medicare beneficiaries. So people can apply for Extra Help at any time. Someone with any Medicaid benefit does not need to apply. They just automatically get this assistance. And then once you are approved, you get help for the entire calendar year. So Social Security periodically redetermines people's eligibility, but they'll let you know. You'll get a notice in the mail if you need to renew at any point. So it's just selected individuals each year who get a form that they have to complete and return. And if you don't get a renewal form, the Extra Help should just continue. If you're approved, you get notice with your Extra Help start date. The Medicare Part D plan is notified, so your costs are lowered going forward. And if you don't have a Part D plan, you're given a chance to enroll or you'll be auto-enrolled in a plan. Okay, and then just briefly, we wanted to mention the PACE and PACENet program, which is a Pennsylvania program. It's a prescription drug program for people in Pennsylvania with limited incomes. One highlight I would say about this program is that it only looks at your income. So for people who aren't eligible for Extra Help because they have too many resources, this is an excellent program for them to take a look at. It's funded by the PA Lottery. They don't count the amount people pay for their Part B premium as part of their income. And applying is really simple. We've got all the application information here. The application is simple, the turnaround is quick, and it can really help people limit their prescription drug costs. So we wanted to give a quick plug. Erin and I have an upcoming webinar on Medicare in 2021 that we'll be doing at the end of October. If you're interested, we've got a link to register, or you can email our office for more information or to sign up for that program. And we just wanted to leave you with a couple of sources of help. The Apprise program that I mentioned is a really good resource. Anytime I talk to a Medicare beneficiary who needs help with their plan choices, especially now during with open enrollment period coming up, or if they need help applying for the extra help program or help with the Part B premium, the Medicare savings program, we can refer them to Apprise to help with that. 1-800-Medicare or mymedicare.gov are both additional really good places to look for help with Medicare issues. And then we have here the Customer Service Center number, a link to the place where you can find the behavioral health choices plans, the health choices plans, and the community health choices plans, and a link to the long-term care handbook and the medical assistance eligibility handbook, where you can find all the rules about the Medicaid programs that we talked about today. So thank you very much. I know, Kelly, you need to launch the last poll.
Yes, for attorneys on the webinar, I'm launching the second of the 2 CLE poll boxes. You must respond to this in order to receive CLE credit for your participation today. And while we have a minute, if anyone has any questions or comments for Erin or Katy, please type them in the chat box now so that they'll be able to address them before we end the webinar.
And please feel free to reach out to us. I know Erin and I are always happy to talk to our legal aid colleagues about problems that especially dual eligible beneficiaries are facing. Or as Erin said, refer people to call our helpline or send an email to the staff at phlp.org, and we're happy to talk with folks about these programs.
Great, thank you very much. Well, I see the same number of people have responded to the poll that did the first poll, so I think we got all the attorney responses, and I'm not seeing any questions or comments coming into the chat box. So if you guys don't have anything else, we can end it for this morning.
All right. Thanks very much.
Thanks for being with us. Thanks, Katy and Erin, for sharing your time and all this wonderful information. Thanks, everyone else, for joining us, and have a good rest of the day.